The Rich Hospital virtually looked empty on Monday morning. Persons who were in dire need of healthcare had their fate in God's hands as they were left unattended to. Our cameras could only capture some doctors going about their duties at the hospital. Clearly, many patrons of the facility were frustrated.
I came here with a sister of mine, and moreover too, she just got delivered. They had a CS on her, and moreover, I heard that nurses are on strike, but they just took off her bandage and just left her just like that and went on strike, which is very bad. So just assuming maybe her health condition is at risk, what could happen?
So as now, she's just on the bed?
She's just on the bed, and no nurses is paying attention on her. And moreover, I went to call one doctor, and what they said is she has a team. And without a team, they can't just pay attention to her.
People had come from far and near to access healthcare. This lady came from the Volta region with a brother who has head injury but has since been denied attention. She's not the only one affected by the situation. This gentleman, with all the bruises, had to return home with his wounds yet to be treated.
At the same time, more patient that they Eshamantino, and also they also make physiotherapy or physio. But your buyers also necessary for cost strike. Into the sea or moon to mean dress it, yes, Anamaye. And also need the also dress it, yes, Anamaye, because one dressing now won't say emu na ahoro abeda ukuna na nemu eoya. Yaba nurse Hanum no moye, or my locunina. Your coffee so also munya, they say in I stranded, and then Nama, they say a copy of young coffee. Because your coffee is here, yet pains away your body. Your coffee, your coffee.
Many departments of the facility have been dejected, and the emergency center is one of such places.
So this is the emergency center where all emergency cases that comes into the facility will be taken care of. On a typical day, you will meet some nurses seated here just to attend to any emergency case that comes in. But currently, all these seats are empty. It tells you that the nurses who are supposed to be here to take care of patients are not here. Let me also say that we have just two health professionals here, particularly doctors, who are handling the number of people who are currently at the emergency center. It tells you that they have been overwhelmed, and so their plea is that authorities settle with these health professionals, I mean the nurses and midwives, in order for them to return to their various posts.
Meanwhile, the medical director at the Rich Hospital, Dr. Emmanuel Sofrenyo, says the absence of the nurses and midwives has greatly affected the quality of healthcare delivery at the hospital.
The nurses are a critical component of the health team. So they are the housekeepers, they stay with the patients, the doctors go and come, they come to review the cases and take decisions, alter medications, the nurses administer the medications and stay with the patient throughout, and then they run shifts. So definitely the absence of the nurses will have a big toll on clinical service delivery. And it's already having a big toll because when you go to the emergency, you see that the doctors are left alone, running, receiving the new patients, managing emergencies, and the same doctors will now have to come and nurse the patient, administer medications, and this is extremely very difficult for them to do under the circumstances.